coronavirus pandemic has hit the Big Apple hard, and in the documentary on the World Service this week, we heard from public health physician Dr. Tom Frieden, who reflected on the ongoing global pandemic and how it played out in his city in New York COVID-19 Diary.
On the 10th of March, a colleague and I asked the question, could coronavirus kill 1 million Americans? By that point, it was entirely clear that this was going to be a disaster. I remembered the peak of the H1N1 pandemic in 2009. I had just become CDC director, and I quickly had a meeting with the president. I was scared. And then the president turned to me after the briefing, and he said, "We're not going to see 1 million deaths in this country, are we, doctor?" I took a deep breath and swallowed, and I replied with a lot more certainty than I felt, "No, Mr. President, we won't." But if I was asked the same question about the novel coronavirus, I would have had to reply, "I hope not, but that's certainly a possibility." On March 17th, I went on to the Rachel Maddow show, and before me, Governor Cuomo was speaking. By that time, we had convinced the city, or someone had convinced the city that they needed to shut, and they had taken initial moves to shut. But it's clear that we didn't move fast enough. It's also clear that if New York City had waited even 2 more days...
I'll tell you a bit about this in a minute. The BBC won't tell you this. It's really irritating.
But it has been.
This?
We need to...
They're not going to tell you the full story.
We need to continue...
No, I haven't listened to it. I'll add on to the end.
Essential health services means everything from the treatment of hypertension to vaccination to primary care. COVID is one huge challenge, but it's only one challenge. If there's one thing to learn from past epidemics, it's the importance of learning continuously. Also, by late March, it was clear that the U.S. response didn't seem to be sensibly organized, and we've paid the price for it.
Well, not to belittle or trivialise in any way the awful tragedy of so many loved ones lost to the current and ongoing pandemic, we should remember that this is not new, and indeed how much worse things were in the 14th century. In The Long View on Friday, Jonathan Friedland looks back at the Black Death.
Right.
And to get a sense of how the pandemic looked for those living through it, here's an account written by the monks of Malmesbury Abbey in Wiltshire.
So, what actually happened in New York and 5 other American cities, which are all of the same political alignment, they sent infected old people who had COVID-19 that were already infected into the care homes.
Oh, yeah.
So that it ended up with more than half the deaths, nearly all the deaths in the United States coming from these 5 cities.
Yeah. Mm.
And they haven't mentioned that at all.
No. Well, they'll keep that quiet.
Yeah. So that's why...
Did they know they had it before going in?
Well, so I'm not quite sure how the authorities are going to treat it at the moment. They might actually put people on manslaughter charges for doing it. Yeah, I don't think if they can prove that it was done deliberately, then they'll put them on manslaughter charges. But
and where was that in New York?
New York was one of the cities. Yes.
One of the cities.
Yeah. The governor Cuomo, who you just mentioned, was the guy who told them to take the old people back in, the infected ones back into the elderly care homes. So then the disease spreads like wildfire. Yeah. I mean, if anybody needs protecting and quarantining, it was the elderly, not the healthy.
Yeah. Well, you mean they sent the younger ones in?
No, I didn't say that at all. I said the elderly.
The elderly, but the ones with the virus.
Instead of separating them and putting them in a temporary hospital, which I had built, they sent them back into with the disease.
Yeah.
So the relatives now need to sue the New York City.
Yes.
Now let's take a look at the possibility of nailing certain governors for putting sick patients back in nursing homes and spreading a certain type of infection among the people there and being basically responsible for their deaths. So we'll start with Rogan O'Handley, who writes 45 out of 50 governors did not force infected patients into nursing homes, but 5 did. Cuomo from New York, Wolf of Pennsylvania, Whitmer of Michigan, Murphy of New Jersey, and Newsom of California. Nearly half of all nursing home deaths were in these states. That's not an accident. That's systemic murder. So here is the law. The immunity of a state from suit or lawsuit has long been held not to extend to actions against state officials for damages arising out of willful and negligent disregard of state laws. The reach of the rule is evident in Scheuer v. Rhodes, in which the court held that plaintiffs were not barred by the 11th Amendment or other immunity doctrines from suing the governor and other officials of a state, alleging that they deprived plaintiffs of federal rights under color of state law and seeking damages, when it was clear that plaintiffs were seeking to impose individual and personal liability on the officials. There was no executive immunity from suit, the court held. Rather, the immunity of state officials is qualified and varies according to the scope of discretion and responsibilities of the particular office and the circumstances existing at the time the challenged action was taken. Which leads me to wonder if there's already lawsuits in the offing and people are bringing things together in order to go after these 5 governors. Then we had this, which our friend pointed to from Steve Scalise. It's a quote, "These governors are withholding information from the public and House Dems are letting them get away with it with their partisan refusal to join our investigation. Republicans are demanding answers from Dem governors about their disastrous nursing home orders." So they're doing a probe into the governor's actions, and several of the governors are not cooperating. So our friend writes, did orders violate government-mandated policies? Would a jury of peers agree with their actions, would agree their actions were reckless? Would a jury of peers agree their actions were negligent and resulted in the deaths of many people, many thousands of people?